Madam Speaker, I stand pursuant to the provisions of Standing Order 44-2C. I wish to request for a statement from the Chairperson of Departmental Committee on Health regarding the contributions policy framework currently being implemented by the Social Health Authority, SHA, particularly with respect to the requirement for upfront annual contributions from participants in the informal sector. Honorable Speaker, the Social Health Authority established under the Social Health Insurance Act 2023 is mandated to administer and restructured National Health Insurance Scheme through the Primary Healthcare Fund, the Social Health Insurance Fund, and the Emergency Chronic and Critical Illness Fund. These reforms are envisioned to enhance equity, sustainability, and universal access to healthcare. In line with Article 43 of the Constitution, however, considerable public concern has risen regarding the directive requiring informal sector contributors to remit annual premiums in a lump sum as a condition for enrollment or continued access to healthcare services. This approach has been widely criticized as financially exclusionary, particularly for low-income and seasonally employed Kenyans who are unable to make such bulk payments. Honorable Speaker, the shift from the previous monthly contribution model under the NHIF to the annualized infixable payment structure threatens to erode public confidence in the SHA and risks disfranchising millions of Kenyans who fall outside the formal employment bracket. It is imperative that this House receives clarity on the policy rationale, legal foundation, and sustainability for this contribution framework. Honorable Speaker, it is against this background that I seek a statement from the Chairperson of Departmental Committee on Health on the following: the policy, justification, and legal basis for requiring annual lump sum contributions from informal sector contributors under SHA, whether there are plans to review or revise the current contribution structure to allow for monthly, quarterly, or otherwise flexible installments options in order to accommodate varying income realities among Kenyans, whether the Ministry of Health or SHA has conducted an impact assessment or affordability analysis to evaluate the implications of this policy on enrollment, compliance, and access to essential health services, mitigation measures that have been considered or are in place to cushion economically vulnerable populations during the transition from NHIF to SHA, and confirmation of whether the current contribution policy has been anchored in published regulations, and if so, whether the same may be amended through administrative or legislative intervention to ensure equity and accessibility. I thank you, Madam Speaker.
Chairperson, Education Committee, Health Committee. Health, Honorable General.
Thank you, thank you, Madam Speaker. That's a very important question, and we'll make an effort to get an answer, if possible, within 2 weeks. But it's fairly comprehensive, but we'll make maximum effort because it's a thing that is important to the whole country. Thank you, Madam Speaker.
Thank you. Okay, you've said 2 weeks. So there is also a request for a statement by Honorable Clive Gisario, member for Kitutu Masaba. Yes, Honorable Gisairo.
Thank you, Honorable Speaker. Request for a statement regarding detainment of a minor in India due to delayed payment for medical bills by the Social Health Authority. Honorable Speaker, pursuant to Standing Order 44-2C, I rise to request for a statement from the Chairperson of the Departmental Committee on Health regarding detainment of a 10-month-old baby Chloe Agnes Nyanchoka Nyang'au in India due to delayed payment of medical bill by the Social Health Authority. Honorable Speaker, baby Chloe a declared dependent of Mr. Boniface Nyang'au Momanyi, member number CR 694-366-499-5724-9 under the Social Health Insurance Fund was referred to Miot International Hospital in Chennai, India for open heart surgery by a consultant pediatric cardiologist at Kenyatta National Hospital. The referral was authorized by the Office of the Director General for Health via a letter dated 8th April 2025 for the period of cover ending June 30th, 2025. Honorable Speaker, on 15th May 2025, Ms. Gladys Nyabonyi Asuku of National ID number 22816057 and passport number BK968376, the mother of the minor, duly signed the Social Health Insurance Fund Shif beneficiary commitment form for overseas treatment. The total cost of treatment was stated at shillings 1,625,000, with a clear acknowledgement that the SHA Gazette tariff for overseas treatment would cover Kenya shillings 500,000. Subsequently, baby Chloe, accompanied by her mother, traveled to Chennai, India on 16th July 2025, where baby Chloe underwent open heart surgery on 21st July 2025.
One moment, member for Kitutu Masaba. Sergeant at Arms, could I have the list of guests who are here? Because I can see the guests are arriving and leaving before I receive the list. You may proceed.
Although she was scheduled to return to Nairobi on 5th August 2025, Miot International Hospital has withheld her release due to delayed payment of the outstanding Kenya shillings 500,000 by the Social Health Authority, subjecting the family to emotional distress and unforeseen financial hardship. Honorable Speaker, it is against this backdrop that I request for a statement from the chairperson of the Departmental Committee on Health on the following. 1. Reasons behind the delay by SHA in remitting the outstanding Kenya shillings 500,000 despite prior authorization and the signed beneficiary commitment and the expected timeline for the payment. 2. Internal mechanisms in place within SHA to guarantee timely disbursement of approved medical funds for overseas treatments, including measures employed to prevent detention of minors such as baby Chloe in foreign hospitals due to administrative lapses. And 3, legal recourse available for Kenyan patients detained abroad under similar circumstances and steps the Ministry of Health is undertaking to prevent such cases from recurring in the future. I thank you, Honorable Speaker.
Member for who's the Health? Honorable Nyikal, Chairperson Health.
Madam Speaker, this obviously is a very critical matter. The child being held, all effort will be made so that we have an answer, a report by next week, if possible, at least regarding the release of the child, even if other policy matters are still to be looked at. Thank you, Madam Speaker.
Thank you. Next, we have a request for a statement by Honorable Timothy Wanyonyi, member for Westlands constituency.
Thank you, Madam Speaker. Madam Speaker, I request for a statement.
Honorable Faith Gitau, stop distracting the member for Westlands.
Thank you, Madam Speaker. Madam Speaker,
for protecting you.
I request for a statement regarding the right to persons to reasonable accommodation in the workplace for persons with disabilities. Honorable Speaker, pursuant to the provisions of Standing Order 442C, I rise to request for a statement from a chairperson of the Departmental Committee on Labor regarding the rights of reasonable accommodation in the workplace for persons living with disabilities. Honorable Speaker, the United Nations Convention on the Rights of Persons with Disabilities and Section 21(2)(d) of the Persons with Disabilities Act number 4 of 2025 requires every employer to carry out appropriate modifications in their workplace premises to accommodate the employment of persons with disabilities. Despite the right to reasonable accommodation, Ms. Phyllis Anyango Ouko, who serves as a Director Administration in the Ministry of Interior and National Administration and is a wheelchair user, was recently relocated from the first floor to the 8th floor of the Harambee House. The decision for the relocation was reportedly made without consideration for her accessibility needs, jeopardizing her well-being. Consequently, Ms. Anyango has reportedly been sleeping in her current office space for 3 consecutive nights to prevent its demolition and secure her accessibility rights. Honorable Speaker, it is deeply concerning that a public officer living with disability is being subjected to such challenges in a clear violation of her right to reasonable accommodation. The Kenya Disability Parliamentary Association, KEDIPA, calls for urgent intervention by the relevant ministry and other state agencies. Honorable Speaker, it is against this background that I request for a statement from the chairperson of the Departmental Committee on Labor on the following grounds. Number 1, actions taken by the Ministry of Labor and Social Protection to investigate the matter and ensure that the matter is resolved while ensuring the protection of the right to reasonable accommodation for Ms. Phyllis Anyango Ouko. Number 2, measures put in place to ensure accessibility of the place of work for Ms. Phyllis Ouko and other persons with disabilities in public service, and steps taken to address discrimination of persons with disabilities in the workplace, including promoting their inclusivity in decision-making processes in the workplace. I thank you, Honorable Speaker.
Thank you, Chairperson for Labor Committee, or a member from that committee. Is there a member from Labor? Yes,
Speaker.
Honorable Donya.
Yeah. In the next 2 weeks, Madam Speaker.
Okay. Someone just murmured that 2 weeks is too long. Point of order, Honorable Pukose.
Honorable Speaker, you know I'm standing in for the majority leader, and therefore 2 weeks I think is a very long period of time, considering what the honorable member has raised, that she's been sleeping in the office for the last 3 nights. And I think we cannot keep her sleeping in that office for the next 2 weeks. I'll direct that the committee gives a response within a week's time so that that matter is resolved urgently.
Honorable Donya, do you think your committee can do it in 1 week? Especially considering we are going on recess.
Oh, well guided, Madam Speaker. I'll give the communication.
Thank you.
Okay.
And before we proceed to the next request for statement, which will be made by the Honorable Walter Owino, member for Awendo, allow me to recognize the presence of Mother Kelvin School from Kandui constituency, Bungoma County, who are seated in the Speaker's Gallery. And also seated in the Speaker's Gallery are staff members from Bomachoge Barabu, staff members from the constituency of Bomachoge Barabu and from Kisii County. And I think on behalf of members of Parliament and the substantive Speaker, I'm going to give the Member of Parliament to welcome them on our behalf. Proceed.
Mike. Thank you so much, Madam Speaker. Madam Speaker, I'd like to say I'm twice lucky because you've allowed me to be able to also welcome my staff, Bomachoge Borabu constituency staff. Yesterday, I was given another opportunity to welcome Kenyenya Junior Academy to the Parliament chambers. Madam Speaker, I would like